we are talking about the European Health Data Space. What is it? The European Health Data Space is a new EU regulation that protects health data. You can think of the European Health Data Space something like the GDPR of health data. And now you may wonder that we already have GDPR that protects the data, so why do we need another regulation, the European Health Data Space, to protect again the data? Why? Well, there are several reasons why we need a new regulation, and in this presentation, we are going to talk only about two of these reasons. The first is that the European Health Data Space enables citizens to download their health data, be careful here, from all hospitals and laboratories they have visited in the past in a machine-readable format. These are important aspects, and we're going to explain them later. And second, the European Health Data Space accelerates research in medicine. That means that, like data collected for primary care, that is, when you go to the doctor, when you have a lab test, when you have a blood test, when you collect data about you, this data now can be utilized for secondary purposes as well, like research. Research for new drugs, for better healthcare, for early diagnosis, etc. So these are the two important dimensions. The European Health Data Space enables citizens to download their health data and accelerates research in medicine. As a regulation, the European Health Data Space gives citizens several rights. The first right is the right to access your data. That is, the right to access their personal electronic health data in the context of primary use and free of charge, in an easily readable form. I'm going to explain about this form later because it is important. It's what we call the format. Second right is that citizens have the right to receive an electronic copy in the European Electronic Health Record Exchange format. Citizens have the right to insert their electronic health data. They have the right to request rectification if the data are not correct. They have the right to give access to a data recipient of their choice, like their spouse, their child, or whomever else. They have the right to restrict access of health professionals, and they have the right to view access logs, much like Enrique said previously. That is, to obtain information on the healthcare providers that they have accessed their data. Now, with the European Health Data Space, citizens can download their health data. For the first time in history, they can request all their data from all providers in a format that can be easily read by computers. This means no more paper, no more handwritten notes, no more misplaced lab results, no more lock-in with a single hospital. I told you that the data are downloaded in a specific format. Actually, the European Health Data Space states that you should receive your data in a specific format called the European Electronic Health Record Exchange format. Because the name is kind of long and kind of difficult, we call it the format. And the format is based on existing standards like HL7 FHIR. That word that you see here, FHIR, the FHIR, we pronounce fire, like the fire. So HL7 FHIR has two important properties. The first is that it is human readable, simple ASCII text. People can read it. Although it can be long, it can be thousands of lines long, it's simple ASCII text. And the second and most important property is that HL7 FHIR is machine readable. That is, computers can read, process, and transfer this format. Now that we explained a little bit about the European Health Data Space, you may have questions like, I can download my data from my hospital today. What more will the European Health Data Space do for me? Well, the European Health Data Space enables users to download all their data from all providers, not just a single hospital, but all public hospitals, all private hospitals, all diagnostic centers, labs, all of them. Wherever they are medical data of yours, you can download them. And you may also wonder and say that my hospital sends me my lab results in PDF. What more can the European health data space do for me? Well, PDF and especially scanned documents in PDF, documents that in paper format that we put in a scanner and then convert it to PDF, cannot be really understood by computers. Computers can print it, but they don't understand it. That is, computers cannot extract the health data from a PDF documents because PDF documents do not specify which text corresponds to medical information like surgeries and lab tests. PDF documents can be printed, but they don't contain that metadata that say this information is about a surgery or this information is about a test. On the contrary, the European health data space requires hospitals to give your data in a machine-readable format in HL7 FHIR that contains this metadata, and you can see what are the lab tests, what are the surgeries, etc. You may also wonder, that is, okay, I downloaded my data in the format. Well, what can I do with those data? Well, for the first thing, you can visualize the whole picture of your health. You can compare and analyze your health data over time, like how has my cholesterol changed over the past 10 years? If you try to answer this question today with paper documents, it will probably take you, 20 minutes, half an hour to assemble all these documents and create a graph. But with the European health data space, it's a click of a button. It's a query to a database. You can do it in seconds. You can answer other questions as well, like in 2024, I traveled a lot for work. How did this traveling impact my cholesterol? How much weight did I put on then? Is my body weight related to cholesterol? Etc. You may also wonder, okay, I can have a full picture of my health data, but is there anything else I can do with my data? Well, lots of things. The sky is the limit. You can send the data to a specialist doctor abroad asking for a second opinion. The system can automatically translate it if the doctor speaks a different language. You can avoid duplicate and expensive lab tests when you go to a new hospital and they request more tests or all tests from the beginning. You can show a prescription to a pharmacist translated in a local language in a different country and get the right medicine. You can share your medical record with your family, that is, for medical history purposes, like genetic disorders, etc. You may also wonder, okay, I downloaded my data in the format, I can understand the uses of it today, but are there any future or futuristic uses that this will enable? Of course, you can connect to wearables and smartwatches. That was our first question in the Mentimeter. So you can connect your medical data to your fitness data, that is wearables and smartwatches, and get a holistic pictures of your health and fitness. Today, everybody's talking about AI, artificial intelligence. So you can use AI health assistants. They can suggest preventive care. They can suggest exercise plans based on your health profile. They can answer questions and provide personalized answers just for you. They can evaluate alternative therapies like which therapy is more suitable for you. And ultimately, you can create a digital twin. And a digital twin is a personalized replica that assists in managing your health. So you say that, that's very useful information, but I see lots of data flying around from hospitals to data centers and from data centers to my local devices, and all this data be moving around. Is that secure? Can I feel safe about the security of my data? Well, yes, it is highly secure because it is fully aligned with the General Data Protection Regulation. You own your data, and you have the right to access, control, and limit its use. All data access and processing activities are logged and monitored, much like Enrique said earlier. You can see who accesses your data, when, and why. And that will happen for the first time in history for the entire EU. Also for secondary use, that is research using your data, secondary use happens only when after an application process. That is, not everybody can access your data, only vetted researchers will be able to access your data. And that access will happen within a secure processing environment. They cannot download your data in their laptop or in their desktop. No, no, no. Data processing happens in a secure processing environment, and your data will be anonymized. And in most cases, you'll be able to opt out of any secondary processing of your data. You may also wonder that I hear a lot about ransomware, and especially in hospitals. Can my data be leaked from the hospitals? Well, in the near future, hospitals will be safer than ever before because the EU is putting together a European action plan on the cybersecurity of hospitals and healthcare providers. This plan will significantly enhance cybersecurity. ENISA plays a leading role in this activity with a new support center, and the center will offer a ransomware recovery subscription service, helping hospitals and healthcare providers prepare recovery plans in advance. Finally, you may wonder, oh, this is nice, but I don't think I can afford it. How much will the hospitals charge me to give me a copy of my data? Well, the answer is simple. Nothing. Not even a cent. They're not going to charge you anything. You get your data for free in the format, in digital form, because using the regulation, it is your right to get your data. Now that we have understood the format of the European health data space, let's examine the story of a potential patient, Marina. Marina is a 40-year-old teacher who is struggling with high cholesterol. She takes care of herself. She eats healthy, she exercises, but she is missing the full picture. Lab results in paper documents, they are hard to process. Sometimes they are lost, especially during house moves, and lab results, they feel like pieces of a puzzle. Marina has a lot of those pieces, that is a lot of lab results, but she doesn't have the full picture. She doesn't have all the pieces of the puzzle. But with the European Health Data Space and the yellow button that Catherine talked about earlier, things will change. Marina is able to download all her results in machine-readable format in HL7 Fire. Marina can see her cholesterol levels over the years, she can consult foreign specialists for a second opinion, and she can join clinical trials. Marina is truly in control of her health. Marina can download her lab results, prescription, medical test procedures in HL7 Fire, and she is able to view all of them in a dashboard like this. She can zoom and compare different tests and have the big picture of her health. This is how the big picture looks like. There is the patient info, which is Marina, the medications she is taking, conditions, care plan, procedures, lab results. And if we click on one of those, say, lab results, we can see her lab results in 2010, 11, 12, 13, 14, 15, 16, and other years. And we can see results of a specific case like diastolic blood pressure, body weight, calcium. So Marina can see how her pressure changes over the year, how her calcium changes over the years, creatinine changes over the years, etc., etc. Marina can translate the results into a different language, from English to Italian, for example, to get a second opinion from a specialist in Italy. Once Marina felt in control of her health, she took the next step. She became an active user of her data. She sent a secure link to her Fire data to a doctor abroad asking for a second opinion. She received the second opinion from a specialist in that area. The specialist also recommended a web portal specializing in her condition. In the web portal, she found the latest scientific developments in cholesterol, and she started attending monthly online meetings and lectures on her condition. Marina made a significant change. She made the shift from following the instructions of her local doctor, like, take this pill and come back in 2 months. So she made the shift from following the instructions to having a deep understanding of how she needs to manage her condition, what she needs to do, and most importantly, why she needs to do it. Now, Marina is really on fire. Through the web portal, Marina found online clinical trials in cholesterol. She entered her data in a clinical trials database, asking to participate in clinical trials related to cholesterol. She was selected to be screened for a trial through her local hospital. for a new experimental drug that may lower cholesterol with less side effects. So the European health data space did not just give Marina the control over her data. The European health data space empowered Marina to reach her full potential in the management of her health. Marina is not alone in this world. Marina has two children. Marina learned that high cholesterol may be related to genetics. Marina talked to her children and had them tested for cholesterol as well. They all started caring about health from a very young age. They all started exercising regularly, and the portal provided recipes for healthy meals. The portal gave advice for children and teenagers with high cholesterol. And you see, Marina didn't just take charge of her own health. Marina became a champion for her entire family's well-being. But you know what the Chinese say? That the journey of 1,000 miles begins with a single step. And Marina was able to take this first step. And the first step in Marina's journey is the yellow button. To get her data in FHIR, Marina securely logs in her health system, clicks on the yellow button, and gets a link to her data in FHIR in a secure server. Marina can now share this link with another application or with a doctor for a second opinion. Marina can also download her data in her local computer for later visualization and processing, much like this screen up here.